Dr. Tony Fauci, and Dr. Deborah Birx used the Imperial College model to persuade President Trump to lock down the entire United States economy. The fraudulent model predicted 2.2 million American deaths from the virus pandemic. The authors of the Imperial College model shared their findings with the White House Virus Task Force in early March. Dr. Fauci and Dr. Birx then met with President Trump privately and urged him to shut down the United States economy and destroy the record Trump economy. A new critique of the Imperial College model finds the study is completely unusable for scientific purposes. The study is a sham. Dr. Fauci and Dr. Birx pushed a garbage model on the White House and the American public and destroyed the United States economy. As reported weeks ago in mid-April, Dr. Fauci admitted that it was he and Dr. Birx who persuaded President Trump to lock down the United States economy, knowing the massive destruction this would cause in jobs, lives and commerce. President admitted that during a press conference in April that two very smart people came into his office and urged him to lock down the economy, or 2.2 million Americans would die from the China virus. But President Trump did not say who those two very smart people were. President Trump. The big projection being that 2.2 million people would die if we did nothing. That was another decision we made, close it up. That was a big decision that we made. Two very smart people walked into my office and said, listen, these are your alternatives. And that was a projection of 1.5 to 2.2 million people would die if we didn't close it up. That's a lot of people. Dr. Fauci later admitted he persuaded the president to shut down and kill off the United States economy. This guy has been wrong every step of the way. Sherry Fink at the New York Times back on March 16, 2020, described the scenario that led to the United States economic lockdown. In a report, Fink describes how Imperial College researchers, including Neil Ferguson, shared their projections with Dr. Fauci and Dr. Birx in the White House Virus Task Force. They even sent a copy of their report to the task force before its release. Sweeping new federal recommendations announced for Americans to sharply limit their activities appeared to draw on a dire scientific report warning that, without action by the government and individuals to slow the spread of virus and suppress new cases, 2.2 million people in the United States could die. To curb the epidemic, there would need to be drastic restrictions on work, school and social gatherings for periods of time until a vaccine was available, which could take 18 months, according to the report, compiled by British researchers. They cautioned that such steps carried enormous costs that could also affect people's health, but concluded they were the only viable strategy at the current time. That is because different steps, intended to drive down transmission by isolating patients, quarantining those in contact with them, and keeping the most vulnerable apart from others for 3 months, could only cut the predicted death toll by half, the new report said. Asked at a news conference with President Trump about what had led to the change in thinking by a White House task force, Dr. Deborah Birx, one of the task force leaders, said new information had come from a model developed in Britain. Dr. Birx's description of the findings was consistent with those in the report, released by an epidemic modeling group at Imperial College London. The lead author of the study, Neil Ferguson, an epidemiology professor, said in an interview that his group had shared their projections with the White House task force about a week ago, and that an early copy of the report was sent over the weekend. The group has also shared its fatality estimates with the CDC, Dr. Ferguson said, including that 8 to 9% of people in the most vulnerable age group, 80 and older, could die if infected. After Dr. Birx and Dr. Fauci sat with the President, the United States went into lockdown, and since that time over 30 million Americans have lost their jobs, and thousands of companies have gone bankrupt. In late March, Neil Ferguson, who was behind the Imperial College virus study, backtracked and said 20,000 Brits may die from the virus instead of his original estimates of 500,000. Neil Ferguson resigned from his government post as researcher this week, after he was caught breaking his own lockdown rules by meeting with his married mistress at his home. And now Sue Dedham, a software engineer for 30 years, studied the Dr. Ferguson's model and concluded it is complete garbage, and cannot be scientifically replicated. In her concluding remarks, Denham says the Imperial College model should be retracted immediately. Code review of Ferguson's model by Sue Denham, not the author's real name. Imperial finally released a derivative of Ferguson's code. I figured I'd do a review of it, and send you some of the things I noticed. I don't know your background, so apologies if some of this is pitched at the wrong level. My background: I wrote software for 30 years. I worked at Google between 2006 and 2014, where I was a senior software engineer working on Maps, Gmail and account security. I spent the last 5 years at a US-UK firm where I designed the company's database product, amongst other jobs and projects. I was also an independent consultant for a couple of years. Obviously, I'm giving only my own professional opinion, and not speaking for my current employer. The code. It isn't the code Ferguson ran to produce his famous Report 9. What's been released on GitHub is a heavily modified derivative of it, after having been upgraded for over a month by a team from Microsoft and others. This revised codebase is split into multiple files for legibility and written in C++, whereas the original program was a single 15,000-line file that had been worked on for a decade. This is considered extremely poor practices. A request for the original code was made 8 days ago but ignored, and it will probably take some kind of legal compulsion to make them release it. Clearly, Imperial are too embarrassed by the state of it, ever to release it of their own free will, which is unacceptable given that it was paid for by the taxpayer and belongs to them. The model. What it's doing is best described as SimCity without the graphics. It attempts to simulate households, schools, offices, people and their movements, etc. I won't go further into the underlying assumptions, since that's well explored elsewhere. Non-deterministic outputs. Due to bugs, the code can produce very different results given identical inputs. They routinely act as if this is unimportant. This problem makes the code unusable for scientific purposes, given that a key part of the scientific method is the ability to replicate results. Without replication, the findings might not be real at all, as the field of psychology has been finding out to its cost. Even if their original code was released, it's apparent that the same numbers as in Report 9 might not come out of it. Non-deterministic outputs may take some explanation, as it's not something anyone previously floated as a possibility. Conclusion. All papers based on this code should be retracted immediately. Imperial's modeling efforts should be reset with a new team, that isn't under Professor Ferguson, and which has a commitment to replicable results with published code from day one. On a personal level, I go further and suggest that all academic epidemiology be defunded. This sort of work is best done by the insurance sector. Insurers employ modelers and data scientists, but also employ managers whose job is to decide whether a model is accurate enough for real-world usage, and professional software engineers to ensure model software is properly tested, understandable and so on. Academic efforts don't have these people, and the results speak for themselves. My identity. Sue Denham isn't a real person, read it out. I've chosen to remain anonymous partly because of the intense fighting that surrounds lockdown, but there's also a deeper reason. This situation has come about due to rampant credentialism, and I'm tired of it. As the widespread dismay by programmers demonstrates, if anyone in Sage, or the government had shown the code to a working software engineer they happened to know, alarm bells would have been rung immediately. Instead, the government is dominated by academics, who apparently felt unable to question anything done by a fellow professor. Meanwhile, average citizens like myself are told we should never question expertise. Although I've proven my Google employment to Toby, this mentality is damaging and needs to end. Please, evaluate the claims I've made for yourself, or ask a programmer you know and trust to evaluate them for you. In conclusion, Dr. Birx and Dr. Fauci misled the White House and the American public. The economy is destroyed and over 30 million Americans have lost their incomes. Dr. Fauci and Dr. Birx should resign immediately and face criminal charges for defrauding the United States government and American public.
Thank you, God bless you, and God bless America.